I have the distinct honor of closing out this afternoon's session. Before I get into my remarks, I want to mention that there is a reception that will follow this on the second floor, so just downstairs. There are a suite of thank yous that need to be delivered. You all know the partners who have been involved in this activity. This would never have happened without the support of New England Journal, Harvard Medical School, the Harvard Global Health Institute, Harvard Sea Change, every Boston teaching hospital, I believe, as well as the Cambridge Health Alliance, UMass. It is hard to pull off an event like this if you've ever tried to do it without an enormous amount of dedicated effort among a large group of people, and I just want to mention a few. Kelly Puyapan, who is here, I'm sure somewhere, has probably lost sleep over this event. Kelly, thank you immeasurably. Luke Testa, who's also here. There's an immense amount of staff support also from HGHI. Sky Flanagan, who's here in the front row. Liz, Marcy, the Sea Change team, incredible efforts. And perhaps above all, you all need to understand that we wouldn't be here today if it weren't for Renee and Karen. When Eric Rubin mentioned at the start of this day that someone pops into his office and plugs him every day about climate change, I'm like, well, that's not surprising. You know, this event, having been in this community for a long time, if you had asked me 10 years ago, would we be sitting in this room talking about climate change in clinical practice, I would have said, yeah, I got a life insurance policy for you. But we're here today, and I just want people to acknowledge the fact that as a group of people dedicated to the care of humanity and our responsibility to society, I consider this a watershed moment in the history of climate change, both not just in the United States, but around the world. And the fact that we have 7 other sites around the world who more or less signed up, I mean, this was not a hard arm twist, folks, that happened pretty much instantaneously suggests that we're not alone. I just want to ask you all by a show of hands, how many people think they heard something today that they can do? Right. So now I want to take a second, just a second, to take a moment and envision what that looks like. Change, you heard, is hard. Small steps are critical. We aren't all sitting around waiting for things to do, and stuff like this can be overwhelming. So it's important, and I'm delighted we had time today, and I hope to talk to each other, and as Karen alluded to think about how we can work together moving forward when we have a reception. But we have to give ourselves some space to think about how we can activate ourselves and each other in a way that will get us to the ends that we really need. I know at the end of the day, for me, you know, I get the great privilege of putting my 2 boys to sleep at home every night. And there is no way when I'm dying on my deathbed and I look back and think about my life that I will have one single moment of regret for every action I take to make this world healthier today for our children, more equitable, and give them a planet that is livable for the long term. And I hope you all feel exactly the same way, because if we all do that, I guarantee you those small steps are going to look really big, really fast. Thank you all for being here.